Hello, this is Dr. Tyler Hamill, Kingwood chiropractor and nutritionist today, talking about part four of my story, overcoming back and shoulder pain. And there's already been 3 parts out there. Number 1 was just an introductory. Number 2 was on the low back pain and disc bulge and herniation. And number 3 was on rotator cuff and shoulder issues on both sides. And number 4 is a continuation on the rotator cuff issues. Remember in the last video I mentioned I had 3 tears in my rotator cuff on the right side, and I have 4 tears on the left side. The 4th tear happened, it was probably 2 years ago, which wasn't from handball, but I just definitely wanted to give it the time because it was pretty darn severe. All of the injuries have been severe, but this one was a little trickier, I guess, that it just seemed to take a long time to get better. And believe me, like, I'm kind of a patient as well, so I know when I'm in pain. And even when I'm doing these rehab exercises like 10 times a day, I'm expecting it to be better a lot quicker than it is, right? And so I know the feeling when patients come in and they're in severe pain, like, Doc, I want to get better soon. And absolutely, I understand that. And I will give you everything you need to make that happen. Like myself, I do everything that I needed to make that happen, but there's still a certain amount of time for the healing and repairing process to occur. No matter what you've heard, there's not a way to speed that up. And I think it's important at this time too, like this stuff, it's tough, it's challenging. Rehabbing and getting better yourself. Yeah, it helps when you go to a chiropractor, acupuncture, physical therapist. If you had to get surgery, that's helpful, right? You couldn't really do that on your own. But a lot of the other stuff, or the rehab type of stuff for shoulder, back, neck, like you're doing that on your own. Besides going to physical therapy, it works 10 times better if you're doing that stuff at home. When you come to my office and we adjust you, we work on you, and you do some of those corrective exercises here, yeah, that's helpful, but not near as much as when you go home and do it 10 times for the rest of the day. So it doesn't matter. I just wanted to reiterate, there isn't a quick fix. So if you've gone to the chiropractor, massage therapist, acupuncturist, if you had a PRP shot, if you had a stem cell shot, if you had surgery, right, you still have to do the rehab afterwards. There's no quick fix where you can take some magical shot or pill and a week later you're going to be 100%. It just doesn't work that way. I know we see advertisements about that all day, every day in social media, lose weight quick or get rid of headaches quick or whatever, right? So but it just doesn't work that way. And it's important to know that, right? Like I've said in other videos, it's important to know that before you start, right? Like, get that in your mind. Like, it takes work to get this stuff better. Probably, a huge majority of people have aches and pains or headaches and whatnot, and they hope by just going to the doctor and just taking a medicine or just getting a pain shot that they're going to be better. And it just doesn't work that way, right? But there's millions of people doing it that way, and they're frustrated because they're not getting any better. All right, so back to the part 4 of my story it's another rotator cuff issue. So it was a couple of years ago. I was golfing, and I felt a twinge of pain in the front of my shoulder. Some of you guys know that have been in for rotator cuff issues that the biceps tendon, it comes right up through this area here. And many people coming in, if they had, or golfers, tennis players, swimmers, when you push in here to the biceps tendon, it's pretty darn sore, right? So think of your biceps tendon when you're moving your shoulder, it goes up and down, like up and down, up and down, up and down. Rotary sports or throwing, tennis, anything like that, over and over and over and over and over again. So you're going to have biceps tendonitis, super, super common. Volleyball players, tennis players, all that kind of overhead stuff this way. So I injured it golfing, of all things, and I hit a shot, and it wasn't even a hard shot or a long shot, and I felt the twinge of pain. I tried to play for a couple more holes, and I could not because the pain was just too severe. So like rotator cuff issues that I've had in the past, this wasn't similar. It was a little bit different. So I thought, well, biceps tendon, there's probably something going on there. And I could feel it clicking, right? Click, 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 click. All when I go to move or try to lift my arm or anything like that, it was pretty severe pain. So I got the MRI, as I usually do. And so instead of my biceps tendon sitting like this, it had rolled anterior. So you could see that in the MRI. So how the heck does that happen? How can it just go from in this groove to moving? It's because there's a little ligament that holds it down, kind of like this, and the ligament busted off. Who knows where it went, but it isn't there anymore. Still not there. So this was intense pain, and any time I went to lift my hand up above my head or even do things, it would pop. Sometimes it would stick and then it would snap and I could move my arm again. It was pretty severe pain. So how did that affect my practice? Well, just trying to hold somebody, like holding somebody's head, like pushing a little bit of pressure on my palm would cause excruciating pain here. So, such as life, I had to deal with it. Nobody knew that I had it, really. And I never tell my patients, right? Patients, when they come in to see me, they have their own back pain, neck pain, whatever. I'm focused on them and their pain. They don't really need to know about, at the time anyway, they don't need to know about my aches and pains. I do these videos now just to encourage people, to show them that there can be natural things you can do to get better. And that's exactly why I do this. So what did I do for this? The typical kind of rotator cuff rehab exercises that I've already been doing. But even when I was trying to do those, it was so painful here because it kept snapping. Any different movements I do, even for typical other shoulder rehab I was doing, it was painful because this tendon kept going back and forth, back and forth. So eventually I decided to get a PRP shot, platelet-rich plasma, which I had in rotator cuff injuries before. This time I just had the one shot, and PRP shots, like, yeah, they're painful. It's not you have a needle going into an area where you have a torn a tendon, and I always say, like, it feels like a needle's in there and it's not supposed to be in there, kind of thing. That's how I explain it. But yeah, so that was kind of painful. It feels like your shoulder got punched a few times or a few hundred times. And the idea with PRP as well is that you put it in there and it takes a certain amount of time for the tissues to heal up, collagen to be laid down, 6 to 8 weeks, right? So I know this. Why do I know this? Because I'm a chiropractor, and I also know it because the orthopedic doc who gave me the injection, he said the same thing, 6 to 8 weeks. So from that point, I did the exercises and the corrective exercises for shoulder rotator cuff issues. Still had the same kind of problem because any position where I was trying to work on my shoulder, it was giving me pain in that area. It was a really weird thing. All the other rotator cuff tears that I have, supraspinatus, infraspinatus, labrum, I could do all this stuff, but with the biceps tendon dislocation, it was really hard to do that. So I was 6 weeks into the rehab and maybe 30% better, only 30% better, right? But of course, for me, I was taking natural supplements. I'm doing all this extra stuff to try to increase the healing or speed up the healing. Again, you can only do it so fast, but rehab 10 times a day by myself, on my shoulder, all this kind of stuff. And I'm just expecting to be a lot better, right? 30% after 6 weeks is, it's tough. It's like, I'm not the best at having patience, but it really tested my patience. So into the 6th week, frustrated. The 7th week, it felt a lot better. And I started to play tennis again and using my left hand. And I did that one time just because I was very frustrated, and it felt pretty good at the end. I could feel like I used it, and I thought, well, I definitely felt like I used it. Maybe I shouldn't have done that. But by the 8th week, and more into the 7th week, I kept playing tennis. Into the 8th week, I kept doing the rehab exercises. 80% better, right? It went from 30% to 80% better in the span of 2 weeks. And partly because I think like my brain and my shoulder hadn't connected in a while. It's like my body or my brain's like, can this really do what it's supposed to do? Like, can the biceps tendon work? Can my shoulder work? It's like, I don't know, because I haven't done it in a long time, right? I hadn't played tennis or anything like that. So yeah, and I talked to the orthopedic guy, and he kind of said, yep, I told you so. And it's like, even though I know that. So again, I'm just reiterating the frustration sometimes when you have aches and pains, right? Like, if you're not doing the rehab exercises, it's really tough to get better. And so people just stay like chronically irritated, right? Because they're just not getting any better. But even when you're doing the rehab exercises, it takes a lot of patience. It's the process. Remember I talked about the process, going through the process, trying to get motivated, enjoy the process in a way, right? 1 week, 2 week, 3 weeks, 4 weeks, all the way up to 8 weeks. And you can see the difference, right? Like I was having a hard time believing after 6 weeks I was going to get better, but only 2 weeks later, and after 8 weeks, I was way, way better. Now, full range of motion. Every once in a while, I can feel a little bit of snapping or pain in here, but I can do everything again. Tennis, golf, I can lift weights and do all that kind of stuff. So again, just trying to encourage you guys. I did a PRP shot, again, platelet-rich plasma, not covered by insurance, but sometimes we have to go outside of the box when we have insurance. If the things they're recommending or prescribing don't work, even if they're covered by insurance, it doesn't really matter, right? It's like, hey, great, my insurance covered, but I'm not any better. I have a name of a great orthopedic doc if you're interested. And it's a very simple process or procedure. No medicine, no drugs, PRP. You're taking the blood out of your own body, spinning it down, putting it into red blood cells, putting it back in, right? So it's simple stuff. But again, with PRP, remember, and any orthopedic doc that gives you a PRP shot, they should tell you, remember, you have to do the rehab. Have to do the rehab, because it just doesn't fix itself and go back to normal by itself. So, Dr. Tyler Hamill, that's part 4 of my story. I didn't want to leave that one out because even though it seems kind of insignificant, because I already had all these shoulder issues, but it was a tough one. So if you learned something from this video, please like it, share it. Sharing this information, these videos, especially on Facebook, it gets it out to more people, because Facebook folks like you guys that are watching, you have 100 friends or 200 friends or 5,000 friends. And this allows, or it's an opportunity for you to spread the word, friends and family for sure, right? Because there's lots of people out there with rotator cuff issues, tears in the rotator cuff, and maybe they're thinking about getting surgery, or maybe they've had surgery, maybe they just haven't done the right rehab or the right things, or the combination of things, for a long enough time. So any questions you have about rotator cuff issues, put it in the chat box below. If you guys have had success with your rotator cuff and rehab, anything that you've done, also put that in. Like, everybody wants to know that, right? If something's working and you had a great experience with orthopedic or with surgery or with acupuncture or corrective exercises or ART or any of that stuff, put it in the chat box below. We all like to learn and love to hear about that stuff. And especially if it's natural things that we can do, like acupuncture and corrective exercises, because that's not going to hurt you in any way. You can always do that for weeks and months and even years. And if it doesn't work, then you could get surgery, right? So remember that. Again, Dr. Tyler Hamill, that is part 4 of my story. Stay tuned for part 5. It'll be, again, on kind of a more severe lumbar disc herniation. And judging by the MRI report, it looked really, really bad. And this happened just about, I think about maybe 6 months or 8 months ago. But anyway, Dr. Tyler Hamill, stay tuned for more. I'm your Kingwood chiropractor and nutritionist, and we will see you soon. Take care.